All right, let's take a closer look at the e-cigarette industry with Jee-dong Huang. He joins me live from Atlanta. He is an associate professor at Georgia State University School of Public Health. Thank you so much for joining us tonight. I mean, we're seeing this global crackdown on e-cigarettes. Is this industry viable? And if it is, in what form? Because a reinvention is clearly needed.
Yes, so on both sides of the Atlantic, there are strong actions taken to curb vaping among youth. And I think the concern among policymakers, both in the US and also in China and South Korea, is that people don't want to have another vaping epidemic among youth. And people are very concerned about recent outbreak of lung e-cigarette or vaping-related lung injuries. I think in the long run, there is a demand for reduced harm tobacco product for sure. And as long as there is a demand, it will translate into market products that cater into this demand. But whether e-cigarettes is going to be this product, it's hard to say because there are a lot of uncertainties. Depends on the regulations and also consumers' perceptions of those products.
I mean, we did hear from the CD today about this vitamin E acetate, which basically is used to cut cannabis for use in vape pens. Do you think that this changes the dynamic? Because it seems as if many of the people who actually got sick said that they had bought products from pop-up shops and other illegal sellers.
Yes, you're absolutely right. According to the CDC's announcement this afternoon, most of the cases of those lung injury involved people vaping THC or CBD oils. And one of the substance that has been identified is vitamin E acetate. This has less to do with manufactured standard e-cigarette products. However, it's not just the scientific fact, it's also a matter of consumers' perception. A lot of consumers don't really distinguish the vaping from vaping marijuana. So when they hear about vaping-related lung injuries, they would perceive those products are going to be more harmful or as harmful as combustible cigarettes. And that perception is very difficult to change. And I think that is a risk for those products.
If the age, and this is something the Trump administration is talking about right now, but if the age to buy these vaping products is raised to 21 and it becomes more and more difficult to access these products, are tobacco companies actually the big winners here? Will these ex-vapers or never vapers just turn to old-fashioned cigarettes instead?
Well, that is a possibility. By raising the minimum purchasing legal age from 18 to 21 for e-cigarettes, if at the same time, if Congress will also raise the legal purchasing age for all tobacco products from 18 to 21, that would avoid this substitution between tobacco products.
You know, there have been a number of deaths linked to vaping so far, and that is absolutely tragic. But realistically, there are far more deaths linked to drinking on a yearly basis, linked to cigarette use on a yearly basis, and those products, by and large, they're not banned outright. So do you think that e-cigarettes are kind of getting a harsh deal here? Because perhaps what is needed is not a ban, but rather better regulation and oversight.
You are absolutely right. Even though the 40 deaths associated with vaping and e-cigarette use are absolutely tragic and put into the context, every year in the United States, for example, more than 400,000 people die because of combustible cigarettes. So compared with the deaths with combustible cigarettes, the number of deaths from vaping is relatively small. So we need to put this into context when we're looking at the regulations and policies towards vaping and e-cigarettes. Yes, I think an outright ban of electronic cigarettes may have unintended consequences of forcing some smokers to go back to combustible cigarettes. And so when policymakers are considering those policies towards e-cigarettes, and I think we do need a careful consideration of both intended and unintended consequences of those actions.
Yeah, and a lot of people have certainly said that the e-cigarettes have helped them sort of quit the habit of smoking. Thank you very much for your insight. Jee-dong Huang joining us from Georgia State University's School of Public Health.